I think a statement I've heard is, that we have a tendency to overestimate the impact of AI in the near term, but underestimate the impact of AI in the long term. And I absolutely think that's true. So I think in the next 2 to 3 years, you're going to see AI in what I call practical applications, like the one I told you, can enhance what I'm doing. Go and really take the initial sort of mold of your solution and find people who are actually intentional about listening, even before you've made the moves. Go to the experts, go to the folks who can give you those pattern recognition. Everyone's going to give you a different cut at it, and go faster and better at doing that. And as opposed to relying on maybe some previous experience and success you've had, and sort of just assuming things based on your own initial that's what I'm saying is push your market research, push your conversations, push your data acquisition even earlier in the process. I really believe, maybe it's taken 52 years to figure it out. If you get, and especially with social media, there's so many things that you can feel, I can do better, I can do this. And I've learned now that, find the things that truly make you happy.
Experience the Next Level podcast. Our guest is Yuri Sudhakar. Bob, what did you think of Yuri?
Yeah, Yuri was a very engaging guest. I mean, he's run a couple of companies. He's had a fantastic career in the technology and the sales space, and I think he had a lot of really insightful quotes to share with emerging leaders and current CEOs.
Definitely. It was great to discuss what he's building over there at Nudj Health with focus on mental health. So let's jump on into it. Jump in and just kind of hear about, kind of what you're doing today and the build up to it, how you got to your current position. Is healthcare kind of what you set out to do, from your younger days, or is it something you ended up transitioning into?
Yeah, it was a transition for me. I will say I always knew deep down that I would be in some kind of leadership position, just from the early days of high school and on. I love taking on ideas and building them and creating them. When I was, playing sports, I always wanted to be the guy captaining the team and leading the team. So that was sort of a natural instinct in me early on. Yeah, healthcare. I arrived in healthcare. I always say I arrived into healthcare. But prior to that, my focus was really on kind of looking at the global economy and really understanding, okay, what are the differences in, developing countries and developed countries, what kind of policies, implementations, best practices that we can take to improve things like education, healthcare, income equality in countries that are developing. So I went to school around that, right? My focus was around international economics, development economics. So that's why I went to school. I went to DC and did my graduate work around that topic. So my focus was on, really that area of the space. So international economics. So arriving in healthcare was interesting. I think my first step into that was actually where I met Bob, right, Bob? We had an opportunity to meet what I call a very dynamic and mercurial founder CEO of a company that was looking at taking this really interesting security technology and putting it into potentially the government and potentially into healthcare. And so when I had moved from all my graduate work in the econ space in DC into the software world, DC at the time was a East Coast Silicon Valley, if you will, at the time around tech. And, I'd gotten exposure into some of the bigger tech companies over there, Siebel, Oracle, and through that had interactions with the government, right? Government agencies. But my dive in it, so that was where I started learning about sort of what I call federal healthcare policy, how the funds are moved, what's going on in terms of deployments in places like the VA, how is policy set at Health and Human Services, how's that actually deployed into sub-agencies like CMS, Center for Medicaid and Medicare Services. And it was at that point where I was introduced to this internet security company that had really exciting technology, and it was a first time I had really understood like this whole concept of what a startup is. And yeah, that's where I started getting into both the exposure in this startup, and then that led the path into what's going on right now in my current company, Nudj Health, where at Anacam we were focused on, can we create security opportunities for these health systems and how health data is exchanged? How do we identify someone who's actually logging into the system is who they say they are? How do we identity proof them? How do we make sure that they're authenticated, right? Which is obviously ubiquitous technology now, everywhere you go. But because we started interacting with healthcare systems and big device companies, I started meeting people on the clinical side, right? So before that, it was all the tech side, right? You know, technology, infrastructure. But I started talking to advisors and people who are the actual clinicians taking care of patients. No exposure to that, right? So that's how it started. And that led me to co-founding a company called Geneva Healthcare that was focused on acquiring clinical data from cardiac devices, right, from 4 big manufacturers, acquiring that clinical data, building the first cloud-based platform to aggregate all that data across the 4 manufacturers. And what I slowly learned in healthcare, or maybe I should say learned really fast, is that technology by itself in healthcare is immaterial. If it cannot solve the clinician or the physician workflow, right, in a way that doesn't overburden them. So what we did really well in that last company is we built a service around that data, which is, hey, not only can we bring the data in from these technology platforms, aggregate the data, normalize it, integrate it into the medical record, but we can provide a relevant and valuable clinical service to augment what the clinicians, the physicians, the cardiologists are doing. And that is really when that company took off, because we both brought the tech capability and the clinical delivery capability together in a really powerful way. So now, well, how do we get the Nudj, right? Nudj Health, which is, you see in my background here. So that was really interesting, right? So we're monitoring all these cardiac patients with devices. Actually, at one point, 90,000 patients every day across 70 cardiology groups and health systems. That's how expansive we were. Because we interacted with these patients, right? We saw trends and patterns. First of all, these are patients who had chronic disease, right? Cardiac disease. The second is they didn't just have cardiac disease. They usually had other things that went with their cardiac disease, or what we call comorbidities, right? Diabetes or COPD or some other major condition. It was never just one, right? Two, what we found was that even after they went through a procedure or had some event, as we interacted with these patients, you know, many of them transmitting from their home, right? So many of them had significant mental health challenges. I mean, mental health challenges overall, that's a crisis in the US today overall, right? But particularly for these chronic disease patients, most of them had some form of anxiety, some form of depression, some form of trauma going on in their life, right? And stress that was impacting their condition. But what we found was not only was that it was impacting their condition, it was driving the behavioral choices they made, how they ate, how they slept, did they move well, right? Were they connected with their community? Were they isolated? Were they drinking more and smoking more? So we started tracking this. It's what I call the vicious cycle. The patient who has a physical chronic condition had a mental health comorbidity. That mental health comorbidity drives the lifestyle behaviors the choices they make, and the behaviors. And those behaviors are the risk factors for chronic disease. So therein lie, in that little frame right there, that vicious cycle, that is happening every day in America as patients with chronic conditions are traversing through the system, right? Primary care, cardiology, oncology, big health systems, coming out of ER, going into ER. This vicious cycle exists. And here's the data on this, right? 90% of our $5 trillion healthcare costs, $5 trillion healthcare costs, is related to patients who have chronic disease and mental health issues. We spend $15,000 per capita on healthcare, right? The other developed nations spend far less, $9,000, $10,000, $11,000. We're even lower, right? So We are spending a lot more money on our healthcare per capita. We're living more disease burdened lives, so our health span is at risk, and our lifespan is shortening. So that is literally the crucible that we find ourselves, Americans, all of us find ourselves every day. Whether we have it or not, whether all of us have that is immaterial because we're paying for that, right? We're all responsible for that cost of care. So that is the kind of what we wanted to solve at Nudge. We saw this at the previous company, right? We were monitoring all this data, we saw these trends, and we went back to all these health systems that are dealing with patients with chronic disease, and we're like, okay, what are you doing about it, right? How do we integrate mental health? How do we bring lifestyle interventions, which are class 1A recommendations across every chronic disease? How do we integrate that? And outside of a few that are doing it, right? The answer is we're not. We're here, we're seeing the patient, we got 15 minutes. I call it the 3 Ps, right? Pills, procedures, and pamphlets. You come in, you give them the RX they need. Maybe it's a procedure. Here's a pamphlet on changing your diet. Oh, by the way, let me give you a referral for mental health down the street. And that is literally the state of American healthcare today, right? And we wanted to solve that in a big way, right? We said, look, what if we built the platform, the team, the devices, the workflow, where we weren't going to go do this on our own. We're going to go, hey, we got this great program and we're going to market to a bunch of patients out there. No, what we wanted to say is, let's go to the place that they trust most, that they're seeing the most, that the stakeholders who are best at explaining and dealing with their healthcare are in that moment. And let's snap into them and empower them, amplify their care, and track and deliver our solution, which is bringing mental health, behavioral health, and lifestyle as an extension of them, and then track the outcomes. And so that stakeholder we're talking about are our clinicians, right? So all these primary care physicians and nurse practitioners and PAs who are really manning the booth, right? Every day in healthcare, all these specialists, cardiologists, oncologists, orthopedists, who all deal with patients with different chronic conditions. Can we partner with them, bring the team with them, bring the reimbursement infrastructure, right, which is critical for them? Can I get paid for partnering with Nudge and having my patient go through this program? And can we track data with them that we're actually shifting their health outcome? We're actually shifting the cardiometabolic profile. Are we improving their mental health? Is their ability, the underlying behavioral health issues around their approach to nutrition and exercise and sleep and staying connected with their community, and how do they think about picking up the next cigarette or the next drink of alcohol, right? How do we do that and do that scale with those health systems and clinicians? So that is really what Nudge is. It is that we built an infrastructure to snap into clinician workflow, right? Allow them in that 15 to 20 powerful minutes, not just hope that the advice that they gave their patients or hoping that the referral out to go find a therapist was sort of left to that patient in that, what I call that vicious, that time in between the visit, right? That vicious cycle, and turn it into a virtuous one where they can go, you know what? We got a team. I got a team. I'm putting in the order for this program to help you really dial in all these risk factors with me. And we're going to track together these outcomes. And so that's what we've designed and deployed across several health systems, independent clinics across the US.
That's excellent to hear, Yuri. Personally, I've suffered from mental health issues in the past, and just hearing that you want to build something to help people deal with that and seeing a direct correlation with lifestyle choices, food choices, etc. That's great. I'm curious to hear any success stories you've had so far with people going through Nudge, what they've noticed, what they've been able to change about their diet, lifestyle, etc., just with the help of Nudge.
Yeah, and I'll say to you, I was my origin story for Nudge was personal myself. I thought I was a symbol of health. Running through a couple startups. I go in to my primary care doctor. I go check my blood pressure, and it's through the roof, right? And I thought that was making maybe it's the one time that you do it in the doctor's office, but it was consistent. And then, I realized, what are the reasons? I had to go research what are the underlying reasons behind, no offense, my primary care doctor said, hey, here's some meds, maybe go monitor your blood pressure, go figure it out. I had to go and dial in and get my health literacy, right? So I'll go to some broader macro data, and then I'll talk about the patients. We rank, if you look at 163 countries, there's a social progress index that kind of ranks 160 countries across well-being, right? And we rank number one in med tech innovation, but we're like 99 in terms of primary care access. Okay. We rank number one in university just at a higher level. We rank number one in university education. We rank like 87 in primary education access, right? Those are corollaries, right? Health literacy, overall educational literacy. What you have there is the population, the chronic disease epidemic that we have. Okay, so back down to the patients. Yeah, what's super exciting is we started doing this, right into primary care and right into cardiology. Doctor would order it, taking on patients. Most of these patients have multiple chronic conditions. I think the average number of meds they're on are 12, across our patient population. Medicare patients who didn't have access. And so these patient stories are, once we are able to connect with them in a proactive way, not them going off on their own and trying to figure it out at urgent care or the ER, right? In a proactive way, we've been able to rapidly bring down depression and anxiety scores, which are high in this population. What we do is we're a measurement-based model. So everything gets measured, right? We're doing clinically validated assessments, assessing where are they in their mental health or well-being, what is their cardiometabolic profile, if they're doing nutrition, right? Their labs, where are they on their movement? So we're tracking all of this. And what you see rapidly in our deployments is that patients go from that order, and in about 16 weeks, their mental health scores are dropping by 50%, right? Depression, anxiety, from clinically depressed to non-clinically depressed. Their lab scores are dropping by percentages that are really powerful indicators that we're doing potentially three things: treating the disease, potentially preventing other risk factors and diseases, and potentially bringing the disease into remission, right? By lowering the A1Cs, the blood pressure, their lipid scores, right? And then you see their movement. So the patients who weren't moving at all every day, sitting on the couch, maybe they were heart failure patients who just didn't feel had the mindset or the power to do that, getting up and moving their trash cans, or tracking their minutes, tracking their ability to do in this elderly population, right? Sit to stand times are extremely important because it's a measure of fall risk potential. Improving the time, reducing the time it takes to do sit to stand, right? Improving the ability for them to do squats. So you see this holistic data tracking of mental health, lifestyle choices, and now they have a community of other patients that they're connecting with, right? So it's not that they're just on the journey alone with the Nudj team and the physician. There's other patients that they're telling their progress on or learning about their progress, right? So at an individual level, we started seeing just these dramatic changes in health span in a short window of time. So then the aggregate data, right? So what we built was, there's not a lot of data out there that says, okay, we can measure this and track it. Like if you go to a medical record now, there's not a lot of that, right? It's mainly documenting the episode, tracking the diagnoses, what's on the problem list, what's the med history, what are the next follow-up things we need to do. But this whole person view of what's going on, right? Mind, body, heart, all that data we're generating, and the aggregate, or what I call the population health data, right? Which is really important, right? We're tracking out of our health system partners. In fact, there's a big press release that just came out 2 weeks ago with one of our biggest partners, Corewell Health. They're the largest health system in Michigan, 9th largest in the country, where they publish data on 3,000 patients going through our program. All right. Profile of these patients are, as I said to you, diabetes, heart disease, obesity, high BMI, depression, anxiety scores. At a population health level, these scores across those 3,000 patients coming down dramatically. So this is, to me, is a huge sign that this is a model of care and a model of care delivery that could work at scale. And for the first time, which we always say, we're not going to split up. It's not, let's go here to seek your mental health and let's go here to seek your nutrition. Let's go here to get some sleep advice. This is, let's dial in all those modalities and get to the underlying behavioral health challenges that patient has. They had chronic disease in the first place because they didn't have the playbook. They didn't have the literacy They didn't have the resources or the time to do that. And boom, in one clinic visit, we can ignite them on this path. So
that's awesome. I'm curious, kind of when you started Geneva and then now moving into Nudge. This is along the time when social media started gaining popularity. I know there are a lot of opinions out there about social media potentially being negative, especially for mental health, anxiety, depression, a lot of things you mentioned. Have you seen any type of correlation as you were building these businesses and kind of tracking mental health? Is that a common factor that you notice in patients? Maybe they're spending too much time on social media or looking at the wrong things, and it just kind of leads to anxiety, depression, and leads them down the wrong kind of rabbit hole.
Yeah, I mean, I'm sure the clinical team that are on would give you, a range of stories that are individual in nature, but also at a population health nature saying, hey, we see things. But I will tell you just generally, especially when you start in the Medicare population, they have a lot of time on their hands. They may are isolated or lost someone, are dealing with loss and grief. And so 100%, I'll say the access to social media may feel comforting at some points, but can it also feel very dangerous where you're in a time where there's, massive, I call it the twin evils of our American society, right? Tribalization, right? Polarization, which essentially leads to tribalization, right? So this feeling of people are sitting on polar opposites. The second is marginalization, that I don't have access to the same opportunities and economic opportunity that others do. When those two not only are felt in your everyday life, but are then reinforced on social media, whether you're a adolescent or especially this aging population that we're seeing, 100% is driving deeper anxiety and depression. I see it just around the elderly people in my family who, they're figuring out their purpose in their day, and then they come back with a bunch of information, and it leads to a feeling like the sky is falling, right? So honestly, the big vision around Nudge, and we're a small company. I always say we're a wedge company. We want to create a wedge, open it up, and if a lot of good can come into that with others filling it in, so be it, right? But I tell my team every day, I want to return, and I know we're going to talk about AI in a little bit, but I want to turn to where it's Americans connecting with Americans, right? And Americans who may not be sitting in the same chair, just like we are, we're in different places, connecting about their purpose and their health and their well-being and their progress and their failures, and that there's a commonality in that, yeah, we may come from different viewpoints, may have different perspectives, but we can all agree that we all want to feel better, feel more purposeful, right? See little incremental change moving in the right direction. Because when that happens, then all the other stuff, the big noise, which is loud, gets reduced, right? So I don't have a solution for how do we solve the algorithms and the social media attack, but I will say is, why don't we create a buffer against that? And the buffer is delivering. People are seeking health care and improvement in their health and well-being every day. And if there are models of that we can scale, that's going to translate to better people, patients, Americans with better mental health. And then when mental health improves, we know the data, people's ability to get well, eat better, sleep, move, do things that are purposeful, go up, right? And I think that is a way to maybe protect us against all that noise, reduce the polarization, reduce the marginalization.
So Yuri, tell me about what transition you had to go through to go from a fantastic technology sales executive, right, to a CEO of multiple companies. So I saw you when you were executive, and you were fantastic. But I didn't see your transition to the CEO role. So I'm really interested to hear about that.
Yeah, and I think maybe even the more interesting question is into, that was in technology, and then go into like clinical healthcare.
Yeah, sure.
Well, I'll say the first thing in that transition is one, you have to want it, right? I mean, you have to want to be a leader, because what many people will tell you is, the CEO, the title and doing all that is great. It's a lot. it's a lot of throughput that you have to deal with. So I think the first thing is, I told you, I always felt like I wanted to lead people, lead companies, change, do things in a leadership way that would improve people's outlook in life, their welfare, their well-being. So I think that was naturally in me. That was the first thing. So I was seeking it. Deep down, I said at some point that's going to happen. But two, you always have to figure out, is that whatever you're going to lead, is it a solution that's solving a problem? Okay. And I was actually hit hard in the face with that when I had to take over, founder CEO role of companies, which is, okay, it's great to say that you're leading a company, but if it's a company that doesn't actually have any intrinsic purpose in the marketplace, what good is that from a leadership standpoint? So I think the first thing that transition is, you have to figure out very rapidly, is there a problem out there worth solving? And what you are attempting to build or lead or take into the marketplace, does it have a solution? The other kind of underlying question is, how ready is the marketplace for that? Right? We talk about the Geoffrey Moore's Crossing the Chasm. I reference that a lot. Right? Do you have enough early adopters that you can trial and test and fail fast on to get it into the marketplace? Or do you not have that? Right? Because a lot of great ideas may come into place, but you have no place to really iterate and test it out. It'll fail. So I think that's the first lesson is, one, I think inherently I wanted to be a leader and take on that responsibility, which I knew comes with a lot of pressure, right? Two, you have to figure out if there's actually a problem that you could solve. And three, I think the most important thing is, can you find teammates that you can rely on that are willing to test and iterate with you, and they trust that process that, hey, I don't have all the answers, but there's something here. If you can convince a few people like that, then you have an opportunity to build something special, because it's so hard as it is. And you both know that, right? It's so hard as it is. If you don't have those, you have to have an intrinsic, there's the three components, I'll say: intrinsic desire to want to build something and lead something, right? Two, your ability to quickly figure out, is there a problem that we could solve with the capabilities that I have? And then three, are there other people that you can surround yourself who trust that vision and are willing to go into the fire, into the crucible with you to go figure it out? So I would say, if you have those three things, so my transition was really going through that, right? Was, okay, I got a taste of what it is to, deliver technology. I got a taste of what it is to be a leader in a company, in a startup. Okay, now that gave me the sort of the canvas to go and figure out, can you go lead and build companies that are important and valuable?
Yeah, wow, that's a fascinating story. And I think that's been echoed by a number of guests that we've had on this podcast before, right? Really making sure that you're clear about what problem you're solving. And it's amazing how many companies actually get that wrong, right? And there's a lot of ways you can basically, go down rabbit holes and waste a lot of time and a lot.
And I'll actually say, I think I got it wrong a couple times, right? We went down one path. The issue isn't getting it wrong, actually.
Yeah.
I would even say that sometimes as a entrepreneur and CEO, you have to go into places that instinctually you may know it's wrong. It may not be wrong, but you got to go test it out. But it's how fast you pull out, right? It's how fast you go, whoa, we can't go in that direction, because capital is so precious, right? That you could really burn yourself that way. Yeah, at Geneva, I remember we had a model where we wanted to go and take a model to hospital systems. That makes sense, right? You're selling into healthcare, you go to hospital systems.
Yeah.
And they're the big player in the space. They got all these patients coming in. And I didn't know. I didn't have any experience selling in the hospital systems. But we took the company down that path, and it sounded nice. It sounded intoxicating that we could do some of the things I talked about around cardiac monitoring in the hospital system. And I think we all thought that. But the problem is, the key to it, I think, to startup and being an entrepreneur is, how long do you take something before you get the data feedback that this is wrong? Sales cycles are too long. Nobody in the stakeholders that you're talking to is caring enough, right? Are there metrics around them measuring it? Is there an economic buyer? Is there a pain right? Is there a pain high enough for them to care, right? Do you actually have a champion that will drive this through the organization? All the things that I learned on the tech side, right? We all did so well on the tech side, and I didn't have that background in healthcare. I didn't realize how regulated it was and how slow it was. So, honestly, we took the company in a direction that there was a period of time where it sunk the company. 100%, it was done. We couldn't even make payroll during the holiday timeframe for the employees, and that's it really slaps you in the face. It's a massive failure point. You've convinced a bunch of investors, and you've convinced yourself, and you've told the team this is where we're going, right? And it all sounds right, but if you're not able to quickly look at the data and start going and really a self-reckoning of this isn't right, and you got to make some hard decisions on what to do, you'll get caught flat-footed, right? In that scenario, Bob, there was a window where the team was not getting paid. The whole model was done. And so what we all, that group that was still there, we all looked at each other and said, this other model that we've been thinking about and talking about, we should go test. Like, we didn't have any runway. Basically, it was going, hey, would you guys be willing to stay on no salary through the Christmas holidays just for one data point to see if this other way is possible, right? I'm giving you a story that I don't want anybody else to be in. That's not a great place to be, right? Brutal. That team had to put everything on the line, our own money, paying out of our pocket, people not taking salary, and then to figure out, let's go for it. Now, that story worked out. We went for it. We figured it out. We put enough in the bank to last us another 4 or 5 months to see we could sign up a few more customers. Huge amount of risk, right? People coming in saying, we'll take the company, we'll carve you out. And we said no, gave them the Heisman, kept on pounding on it. And we found the model, and the model grew, and we grew into a really successful business, right? But my advice to anyone is, you don't want to be there. That is a very traumatic place to be. I'm still scarred by it. And it's hard. It's really hard because, the best thing you can have as a CEO is the patterns, right? You take patterns and kind of figure out decision-making. But it's easy to fall into those traps again. But that is definitely something that I learned, which is you have to quickly figure out how to pivot when things aren't working out, and be really quick about, like, is this a systemic issue or just a blip? And that's the challenge, I think, of every startup founder, CEO.
Yeah, wow, that's a fantastic story. It sounds like it was pretty brutal, and I'm glad that you were able to turn it around. It turned. It's a great turnaround story, right? So what skills, so you talked about the skill of figuring out when to pivot. That sounds like that was a kind of skill that really, you can't get any formal training on that. Hey, how to pivot training,
Sure.
So I'm curious, were there some other skills like that you had to develop as a CEO?
Yeah, I mean, I think the other thing, and maybe this is the sales aspect of it, right? My other right. I was actually got a great advice from one of the original investors in Geneva at this time, and his advice was, you can't rely on anybody else to sell the story except yourself. And as painful as this is, you got to go out and pound the pavement every day, tell the story, refine your story, craft the value in a way that is acceptable for your potential buyer and then the potential marketplace. So the other thing I'll say is, I think if you're going in there, obviously I said you need to have good team members, right? That isn't wow, I got team members to go do stuff for me and I'm going to be CEO and, be excited about it. It's a painful, I'm not going to, sugarcoat it. It's a painful grind. You have to go out there and you have to be in front of the customers. You have to tell your story. You have to get punched in the mouth, maybe, sold to, hey, we really love what you're doing. You don't hear from them. Like, you have to go there. I don't know if it's a skill, but I guess it is. The skill is you have to put yourself out there. You have to go out there, right? I think mistakes that maybe CEOs who have done it before do is, hey, I had the model and the template before. I'll just take whatever that template and slap it in here. And I think every new idea and company and startup still needs that original person who is thinking about it to go out there and actually see if it sticks. You actually have to figure out if you can cross the chasm, right? And so I think the other big skill set is you have to be the messenger, you have to be the deliverer of the message, you have to get the feedback from the message, and then you have to craft, because that's how the pivot happens, right? So yes, you have to pivot. Is the pivot just from data points from other people coming and telling you, or are you the acquirer of that data? So that's the other thing, is you rely on a lot of potential experts or advisors or guides or board members or team members out there giving you data inputs about what's happening. But ultimately, that will actually hurt you if you only rely on that. You have to go really deep into it, know it well, and collect as many data points as possible, because that's actually the best way to make a decision on where do I take the company.
Wow, that is cool.
The other thing I'll say is I don't know if this is a skill set, but it's certainly something I abide by, is you can't just put your sweat equity into the game. You got to take cash out of the bank and put your financial lifeline on the line. That will drive your behavior in ways that you can never get when you're relying on other people's money. Don't get me wrong, you need other people's money. I've raised capital from other people, but my advice is on every single round, you deploy your own capital and you tell the investors you're doing that, because that is the way to drive you getting the data, you getting the right team members, you figuring out where the market is in a rapid manner. And when you have skin in the game, that's the only way to do it. So my other advice to founders is put your own money in, feel that burn, because that's going to really hone in your skills.
Yuri, during this process of building out your first company, did you have any resources that you leaned on or mentors? I know you had that one investor who gave you a bit of advice, but was this kind of more trial by error, or what kind of was your guiding light throughout building this?
We just talked about acquiring data, the data inputs. Yeah, I mean, there were so many people along the way that provided feedback loops, right, and patterns. And in fact, actually, what I've learned is that actually helps you in your, if you're building your next company or next stage of growth, is you learn the people who can give you really good pattern recognition at levels that you can't do, and feedback loops. So I would say surround yourself and find the people who are really good at identifying patterns. Perhaps not even in industries that are specific to the one you're in, but they've done it at a broader level and can just see general patterns, right? But I would even say the founder, I would always call my co-founder of who came in to save the company in Geneva at a time when it needed it, was just that kind of seasoned advice, and a person who's built businesses and scaled them. Is even just from as a CEO, the mental health aspect of you're dealing with all these things, and you need some people besides your own team and potentially some advisors to be able to go and talk to and say, I'm at a loss. I'm feeling the weight of the world coming down on me, and here's what I got. And it's hard to bury your vulnerability in your soul. I wasn't very good at that. I still struggle with that. That's today, right? But you have to be able to say, like, here's what I got. I don't know what to do. Here's my vulnerabilities. And if you can get those, so there were people, actually, that individual, Don Cohn, he's the one who co-founded Nudj with me. He was passed away when he was 93 years old, but at 93 became suddenly, he was a symbol of health, alert, read every day, could understand the numbers that we talked about a week ago in detail. This gentleman was not only a mentor for me, but was a guide through all the kind of the hard times at the last two companies and at Nudj. So I do think you need to find that person. I would even say for other CEOs, you may have your board and advisors, but you need to find someone who you feel you could really just talk to in a vulnerable moment, so you don't have all the answers. I have that now. At Nudj, I have board members who are really there for me from a mental health standpoint, along with strategy.
AI is a buzzword now. So many people out there using ChatGPT, Claude, building apps, etc. I kind of just want to start by getting your personal take on AI. Is that something you utilize just personally or even in the business? What are your thoughts on it?
Yeah, I mean, I personally use it. I use pretty much every day. I use ChatGPT as a sounding board, as a researcher, as a help me craft ideas or messaging or pulling different disparate parts of thought processes together. So 100% I use it. I find it very valuable. I also recognize what it is, which is a draw from other learnings and other evolutions of thought and data points, that it's not the be all, but I can leverage it in a way that's very valuable for me. So yes, I use it every day. I love it. I think it's really important too, because also in a startup, you don't have a lot of resources to do everything, and everybody's doing a lot of things. So when you have something like a chat GPT that can come in and help you, now from my outlook as a CEO, right, I'm sure other members on the team use it for their different reasons, but it really helps not having to ping the team with a bunch of things out there that you naturally couldn't get before, and right at your fingertips you have that. And again, it's all about quick decision making. You're always, we know this, like, as a CEO, there's so much nuance going on in the business. Conversation here. How do I drop this in? Do I wait till Wednesday? Do I, what kind of market size is this? Do I go here and go here now, or go there tomorrow? All those things are sort of a mixture of subjectivity and objectivity, and having AI with you to help process through that is really valuable.
Definitely. What about business wise? Have you explored working it into Nudge? I'm sure with its ability to be able to read data and correlate and make educated guesses and whatnot, I think that probably would be really beneficial, especially back in the early days of Geneva.
Yeah, AI is going to be massive for us. And I actually, myself and the tech team, we talk about this every day. It's going to be massive for us. In fact, I think for companies like Nudge, which are all about human engagement, right? Empowering that connection between the clinician and the patient and us as a partner, the effects of it are going to be incredible. And so we kind of lay that out. One, the rate of AI adoption or AI technologies out there is dizzying, and there are going to be winners and losers of that. So we're watching that very carefully, right? So we are a company. We think of this as there's external AI companies, meaning I am an AI company and I want to sell AI to a bunch of people and I want to create revenue. And I just kind of told you, we are a company focused on helping people's health span through elegant human engagement with our clinicians, right? Where AI comes in is we see ourselves as, let this external AI world just burst into the scene and draw the best of those foundations, whether it be Claude or Google or ChatGPT, and carefully figure out how to maximize those AI deployments into the platform. So there's three areas that we look at this, right? So the first is, the classic generative AI, which is, can we take the interactions that are happening with our patients, our clinicians, and our team, remove the laborious note taking that happens, right? And instantly take that, generate the data, and then transpose that data back into our data set where it gets clinically documented. That alone will create margin differentiation of somewhere between 10 to 12%. So we're already testing that out, right? Number two is what I call the conversational AI, which is, okay, are there things in the conversation? Are there things in the conversation as in a process, right? Are there things in the process that's happening in the company where the AI can pick up and say, here are the 5 patients that are trending the wrong way, right? We need to intervene. Here is data sets that are showing that we need to engage with patients. The feedback is saying patients are not engaging in this type of program. Let's go deploy. What that does is it enhances patient adoption and adherence and better outcomes, right? So that drives value in the business without having a lot of people having to figure that out. And then third is what I call, and a lot of people are kind of looking at this space, is agentic AI. Can we have in our clinician experience enhancements to their interaction right, with an agentic AI, like an avatar, who partners with a health coach or our behavioral health team or our nutritionist saying, hey, we're tracking a lot of the stuff we're interacting with the patient, maybe through the app, getting an assessment, recommending a type of a diet, or alerting us that a patient needs some help based on input. That kind of back and forth, where normally you would have to add a lot of resources around that, right? That's how we see that. So those are kind of the three stages with the goal. With the goal is, I go back to our original mission. I want Americans connecting with Americans. I want clinicians connecting with patients, right? I want that human experience, the one we're having right now, to even be better. So can I relieve our teams of all the things that would happen around the scale, relieve it so that they can continue to do all that sort of well-being connection, that purpose connection, improving health outcomes, and not burning them out. And so that's how we see it, those three layers. And we're actively testing it out. We're looking at different platforms. And I would even say what's more exciting is, we've collected data now on outcomes and trends and assessments and engagement activity on over, 13,000 patients. We're beginning to build our LLM model on top of that, right? So, if you think about all these inputs that come into Nudge, we've got, connected device data coming in, blood pressure, weight scale, pulse ox, right, coming in. We've got those alerts coming in. We've got mental health scores coming in. We've got lab scores coming in. We've got inputs from the team about interactions coming in. So we've got all these inputs that database now is becoming an extremely valuable way to understand, like, how do we now transform health span at scale? So we really believe, as we continue to integrate ourselves into more health systems and clinics, and expanding our capabilities and delivering our care, our AI potential actually grows. And we're going to allow the innovation on the outside to keep on going. And then we're going to pull it in and test it out and then leverage it, not only for margins, but for actually better care and better outcomes.
That's great. With the speed that AI is advancing, are there any potential benefits you see on the near horizon, the next 2 to 5 years, or even potential challenges, maybe with, protecting data, PII, HIPAA, et cetera? Any of those things that you see in the future with the way AI is advancing in your space?
Yeah, obviously there's sort of broad overarching regulatory talks about AI, right? And then in healthcare, it'll be even more focused. We always look at everything from a, privacy, patient protection standpoint, but we also, we have, when we connect with patients, we're very transparent about what's going on. And if you explain to your customer and patients the value that you're providing and they consent to certain things, then you can literally leverage the data to improve their lives, right? So I would say it is a rapidly evolving space. We're in a regulated environment. Obviously, we're going to follow whatever is dictated from, the healthcare policy side around AI and data protection. But you already see changes already happening on the federal side, right? We have our first solution, AI solution, that has been approved for reimbursement, right? Which is looking at heart scans and using AI. So, we're seeing that the move on the regulatory side is, if there's a huge improvement to patient care and to population health without sacrificing, privacy and quality, then you're going to continue to see that go into the healthcare space. And we're going to obviously ride in the wake of that.
So, Yuri, I want to do a quick little segment here, just an AI hot take. I'll give you a chance to give 2 to 3 potential insights or predictions you might have for AI in general, AI in the healthcare industry, positive or negative. What are kind of some hot takes of where you see AI, say 3 to 5 years?
I think a statement I've heard is, we have a tendency to overestimate the impact of AI in the near term, but underestimate the impact of AI in the long term. And I absolutely think that's true. So I think in the next 2 to 3 years, you're going to see AI in what I call practical applications, like the one I told you, can enhance what I'm doing. But you are going to start seeing that taking out chunks of sort of the displacement on labor. For sure, you'll start seeing that. But on the healthcare side, I would say I think AI has massive opportunity to transform the inane and laborious nature of clinical documentation. I think that's going to free up, clinicians' time to help their patients. It should free up. But what ends up happening is that, if it becomes more of a race to become more quote unquote efficient and not really help with patient care, then you're not really solving the problem, right? So that's number one. And number two, in healthcare, AI right now is being used to really create, hey, can I code better? Can I bill better? Can I drop bills faster? And then the other side of the AI world is, can I, make you do more pre-authorizations better? Can I deny these claims better? Can I, sort of stop the acceleration that's happening on the revenue creation side? I think there's going to be some really exciting things that happen around clinical documentation. I also think there's going to be some fallout on revenue billing creation in healthcare. Like, I don't have all those details. It's hard to see, but I think personally for us, we're going to benefit a lot from it because of the human engagement aspect that we deliver. That's just going to get better and better with AI.
Yeah. So Yuri, given all that you've been through, what would you do differently if you could start your career over with the knowledge and experience that you have today?
Have $1 billion in the bank and start the company. I don't know. I mean, I really feel like what was meant to be was meant to be. I'm here because of those experiences. But I understand your question, right? I understand where you're trying to get to. Like, looking back, what would you do? I really think I would actually, this sounds really odd, I would get out into the marketplace and understand your customers. I would even do that even faster. I would do it even faster and better. Even in Nudge, what I thought was an intuitive opportunity, right, in healthcare was not intuitive. And so we now understand how to figure that part out. But again, if I look back and said, if I really, really went through everything I was designing and went back and pinged the marketplace even faster and better, then I would have designed a much better company faster, right? So,
and what does that pinging the marketplace look like to you to get that feedback?
Go and really take the initial sort of mold of your solution and find people who are actually intentional about listening, even before you've made the moves. Go to the experts, go to the folks who can give you those pattern recognition. Everyone's going to give you a different cut at it, and go faster and better at doing that. And as opposed to relying on maybe some previous experience and success you've had, and sort of just assuming things based on your own initial that's what I'm saying is, push your market research, push your conversations, push your data acquisition even earlier in the process. So if I had to do it all again, we would have done that at Anacam, we would have done that at Geneva, we would have done that at Nudge.
Very good, very good. And how about any resources or books that have been really, or courses, right, that have been a real, powerful influence on shaping your leadership journey?
I mean, one of my favorite books is The Hard Thing About Hard Things by Ben Horowitz. I love that book because, there's so many lived real stories in there that, as the founder or CEO, resonate. And it makes you realize, okay, wow, someone has gone through this. And there's a lot of really great lessons about what to do. Not all of it is going to be, analogous, but again, this is all about trying to see patterns in what other people went through. The other is, I love Measure What Matters, right? Because at the end of the day, you have to figure out, and it's easy to get away with it, right? You're just kind of running through your operations, but you have to figure out what are the measurable deliverables that you can hit. And not all of it has to be written in the OKR, right? But you have to kind of come up with your wickets that you have to go through, and then kind of frame the team around that, hit them, and see if you can go on from there. And then if you're not hitting them, what the heck is going on in the business, right? Going back to the pattern and data acquisition and making decisions fast. I would say that, there's a lot of books, but yeah, I love historical fiction just generally. So, David McCullough books, Gore Vidal books. I'm recently reading, was it Robert Harris, right? He's the guy who wrote The Conclave. There's just historical fiction, I think, is great because it brings in sort of, again, back to patterns, right? History provides patterns of what you should be doing now and into the future. I tend to like those type of books. They may not necessarily be a business book, but patterns of leadership and authority and governance and rebellions and resistance, those are all sort of that storytelling that can be translated into the business world.
Yuri, I want to ask you this little off script here. I'm curious your thoughts, being in the healthcare industry, on peptides. I know we've used various peptides for many years, insulin, that kind of thing, but I know a lot of new ones are gaining popularity. So I'm curious if you have any opinions one way or the other.
I don't have a lot of insight into peptides, but I'll make a comment about what I see in the space, right? So we see the longevity space just skyrocketing. And frankly, I am, as an individual, I'm very focused on that. What are the right things I should be doing, taking, eating? How do I work out? I'm 52 years old, right? So I'm sort of trying to hone in my own health span and lifespan. But I would generally say, right, if you look at blue zones, right? Have you heard of the blue zones?
Yes.
Which are 5 areas in the world, and there's a blue that whole blue zones thinking and theory and application is incredible. But if you look at that, you tend to see people who live longer and healthier lives, they're in environments where they're generally eating well, they're exercising, they're eating whole foods, right? They're connected to their community, and they have a sense of purpose, right? And I would generally say that, again, not being a scientist and not knowing all the details of peptides and all this type of stuff, is that when you can incorporate and do those things consistently in your life, you have a chance of living a healthier, longer life. And the longest actual study on longevity, I think it's an 83-year study on longevity, I think it was, done out of Harvard, shows the number one factor for longevity based on that study is how connected you are to your family and your community, right? That's the number one factor. But maybe if peptides is you stay, can we take a peptide that makes us more connected and more purposeful in our lives? That may be the one that actually makes us live a lot longer. But the flip of that is what I'll say is about where Nudj is, right? So there's a lot of stuff going on with longevity, which is awesome and it's great. I don't really have a lot of comments about what will work out. Maybe it's like AI, right? There's going to be winners and there's going to be losers, and like in every endeavor. But we're really focused on the chronic disease issue, right? So there's going to be 80 million Medicare beneficiaries coming into the system, or will be in the system in about 20 to 30 years. Right? 90% of those folks are going to have a chronic condition, right? We have now, obesity has replaced malnutrition as the number one issue for childhood health. And so we have these two sort of huge issues, right? Younger people are going to be dealing with more chronic conditions, and older people are more disease burden. So I'm focused on how do we deal with that, right? How do we get basic health literacy into whole person care, into the American health space, and really begin to create remission in those areas. So I guess my hot take is I think longevity has a purpose. I really think that I'm excited to learn more about it. I myself look at these things going, what's out there, what should I be doing? But the basics of eating better, sleeping better, moving more, staying connected, being purposeful, and loving those in your community, I think is what's really going to drive health span and lifespan in this country.
Practical wisdom, what do you give them?
Listen, ask a lot of questions and listen. Acquire as much data as fast as you can. When you're in that position, I'm thinking more of this from an entrepreneur standpoint. I know there might be people kind of moving within a corporation, is be willing to put, what you're doing on the line, right? Whether it be in a corporate metric, right? Or you're the one starting the idea. You have to be able to put all of it on the line. And then the last thing is it's an intensity that comes with starting anything or leading anything. And you have to be prepared for that. I think you have to stay calm in the moments that are pressure filled. And that is again, I don't know if I wonder if I'm actually giving really good advice to people, because it doesn't sound very tangible. So I worry about that, but you have there are going to be, whether you're in a major leadership position, Bob, you've led, huge organizations, or you're starting a company and you've got to, figure it out. You have to literally learn how to settle yourself. I've had a lot of people tell me like, hey, go do meditation, calm yourself down. And I actually think that's really good advice. And I've figured out how to breathe in those moments when everything's coming at you or you feel it's all on the line. I still am trying to improve that. But I would say if you get frazzled by it, it's not the right position for you.
Yeah, that's well said, Yuri. I do think that, what you've essentially said is nervous system regulation and your ability to change your state, right? So that you're not buffeted by the challenges of the world when they come to you, either, in the business world, yeah, of course, but also in your personal lives as well. We have all kinds of stuff that we have to deal with in our personal lives, right? And so the ability to stay cool, calm, and collected, and know that you're going to be all right, and having that confidence, right, is really key.
We were soccer guys, right? And we know. I was telling my son this the other day. You see the ones that it looks slower, like we were talking about Vinicius, right, on the left side for Real Madrid, and my son was saying he's running really fast, but he looks like he's not putting any effort into it, right? But we know he's putting a ton of effort into it.
Yeah.
Right? Those great players or those leaders, it slows down for them, and the inputs that are coming in that can disrupt you 100%, you have to encounter them, right? I think one of my favorite things I've seen Elon Musk say is like being a CEO is like, what is it? Like standing at the edge of an abyss and eating glass at the same time, right? You have to deal with the worst problems. And one of them is the company could go under at any moment, right? You have to slow it down. And that's what the great athletes do, that's what clutch is, right? Is that in that moment of highest pressure, Derek Jeter just looks like he just woke up and he's taking a couple swings and he hits a clutch home run, right? Jordan hits that shot. He's failed a million times, but it looks like every time is the winner. That's hard. That I would say that's the key. And it's in a mixture of tangible and intangible. Like the tangible is learn how to breathe and how to relax. The intangible is, is there a skill around taking all this input and all this stuff coming at you and going, yeah, I got it. I don't know. But I would say to you, 100%, that's what I would advise people going into these type of roles do.
Yuri, I know we covered a lot through this. It's been great so far. Is there anything that we did not touch on or cover that you would like to discuss?
I think the last, maybe the other thing I thought about is there are going to be decisions that you make that are going to be sometimes that can be painful for yourself and for others, but you have to trust the process, going back to reading the data, and you have to surround yourself as you're building with people who can guide you, right, and that you trust as well, that they can give you good feedback. So again, I think this is just one of those where you're having this podcast for future leaders or current leaders or things we can share with each other, but having people that you can again be vulnerable with is going to be, I think, a very important quality, is learning how to be vulnerable, because that was the biggest thing I learned. Was I wasn't very vulnerable. I wanted to showcase to everyone I had it all under control all the time. I got it. I'm the man. And I learned that when you aren't like that, actually is when you become a way better leader and a deliverer of the mission. So that's my last thing I'll give as a I don't know if it's advice, but something I've learned.
Yeah, great. So where can people get in touch with you, Yuri?
Get in touch with me?
Yeah.
Like, you want me to give my personal information out? And
yeah, I think your cell phone and your personal email address.
Social security number, yeah. Give it up.
So my social security number. Now, if it's a wire, I'm on LinkedIn. I don't know if you have people on LinkedIn, but I'm on LinkedIn. Also, you can just email me. I mean, I love to connect with people who are who listen to me saying, there's a couple of things in there that, I think I'm going to give you some better insight on, or improved insight, or said, hey, what you said resonated. Can you talk to me a little bit more about that? So I actually want to hear feedback from people who are, been through things in different ways and done something better or more insightful. I want to learn from that. So I guess I can give my email.
Yeah. You're Nudge. Maybe you're Nudge Health. Maybe you're Nudge Health.
At Nudj Health, NUD. That's right there.
Yep. There you go.
NudjHealth.com. Yuri at NudjHealth.com.
Awesome. Well, it's been great, Yuri. Really, really appreciate it.